I am Dr. Alison Small. I am a senior research scientist at CSIRO Agriculture. I am part of an active team of scientists and technical support officers that do an awful lot of work about animal welfare, painful husbandry procedures and analgesia for livestock. There are two types of pain, and we can consider them fast pain and slow pain. The fast pain is the pain when you cut yourself, but it passes very, very quickly. The body has its own internal mechanisms to damp it down. That's then followed up by what I would call slow pain, where the pain actually develops over a period of time. Take, for example, when you do cut yourself, there's that initial sharp pain, but then you probably don't feel it for an hour, maybe even 2 hours before it really starts to throb. And that's these COX-2 receptors being expressed by the damaged tissue. And it's those receptors that meloxicam acts on to damp down that pain response. From a lamb's point of view, it's the slow pain that makes it difficult for lamb to find his mother, to follow the flock. Slow pain is the pain that is actually going to work towards lamb losses as these lambs get left behind.
I think producers are becoming increasingly aware of the animal welfare responsibilities, but irrespective of that, there will be the consumer pressure for knowledge about how animals are treated in the production of wool and meat products. The difference between local anaesthetics and non-steroidal anti-inflammatory, such as meloxicam, is that basically local anaesthetics are generally shorter acting, whereas the meloxicam provides a somewhat longer period of pain relief. It also does tend to reduce inflammation as well.
We don't actually have to give the non-steroidal an hour and a half before the procedure because the pain isn't there an hour and a half before the procedure. The non-steroidal can be on board at the time of the procedure, but as the slow pain ramps up, so is the effective dose of the agent within the bloodstream.
We join 9,000 merino ewes every year to fine wool rams. I think pain management tool assists us in the recovery of the lambs at marking time. A lot of the jobs that we do at marking time, we actually don't want to do them. However, we know that there is some pain associated with them. If we can give pain relief for those jobs that we do, I think it's very good, and for the animal rights groups, it shows that farmers are out there trying to do something for the welfare of their animals.
I think once producers start using pain relief and they observe the animals for the next 24, 48 hours, if they haven't previously been doing it, they'll notice quite a difference in the way the animals behave. Shortly after treatment and operation, they will mother up more readily, start suckling the ewe, and then just act like lambs that hadn't been treated to a large extent.
When it comes to delivery of the analgesic, traditionally we've had injectable analgesics. They are not that easy to administer. It takes a little bit of practice, and in a fast-moving commercial situation, there isn't much time to get the injection properly drawn up into the correct position, into the correct tissue. And also you have the risk of self-injection, so a health and safety risk. You also have needles that then have to be thrown away, so we have a potential environmental risk.
The absorption rate is actually reasonably quickly, and the effect would be available to the animal in approximately the same time as if it was injected. And with a thing much like a drench gun, so most producers will find that very simple and easy to adapt to.
And it'll start kicking in about the time that the anaesthetic's wearing off. This is what we can use for little calves. We can use it for disc biting little calves, which obviously don't have to be in a Red Angus stud. Dehorning lame cattle that are quite sore. Where I send you out some antibiotics, I can also send you a bit of this. It's just applied orally. Yeah, it's just a really easily administered analgesic. So this should kick in within, start feeling a bit of pain relief from it fairly shortly, and it'll last for up to 3 days. All right, Matt, that'll make you feel better.
Just like giving a drench, yet it's a lot less product. Very simple to apply and does not take any extra labour units. So there is a huge benefit in the buckalgesic compared to other brands.
I think in lambs especially, when you're doing some of those routine husbandry procedures, you know, they're big mobs, you're bringing them in, you're working with the lambs, and then you're trying to get them to mother up and you're trying to get them back to the paddock. I think anything we can do to help those lambs to not forget about what just happened, but to help them with pain is going to help us from a production angle dramatically, as well as make us feel a lot better. So I think sheep and cattle are the same. I think when they're in pain, their social activity is different. They don't mother up as well. They don't move as well. You know, they show behaviors such as kicking at their belly and just sooking, so to speak. And so I think both cattle and sheep will benefit from pain relief for routine husbandry procedures, absolutely. Not even going to know they're 2 stones lighter.
I think it's quite possible we will see a reduction in mortality rates of the lambs and other animals that are treated. Cost is always an issue for producers, but I think more and more people are starting to see that the initial cost is actually repaid along the way in terms of better animal welfare, and I think there are going to be some demonstrable benefits from better animal production as well. We've already seen some benefits in increased prices in wool production, particularly small but measurable increases in wool prices for those lines of wool that have been registered as having been treated with pain relief.
I think there are a number of organisations who would love pain relief to become mandatory, and I believe that the Australian industry is mature enough that it does not need to be mandated. I think the Australian farmers know what is the right thing to do, and I'm pretty sure that pain relief is going to increase in use just because it is the right thing to do.
We have to do everything we can to protect our animals and show that we're doing the best thing we can for them with as little pain as possible.